Hey everybody, I am super excited because my good friend Dr. Sanjay, interventional cardiologist, is here for the second time. I thank you so much for
The
coming
guest's
on.
so nice you invited me twice. Is that what it is?
Dr. Sanjay, give me your 76-second bio.
So my name is Sanjay Bhojraj. I call myself a recovering interventional cardiologist. So in my former existence, I was the doc that you met at 2 a.m. when you came in with a heart attack. Opened up your vessels, we high-fived, we chest bumped, I put you on 5 or 6 different medications, and we follow you forever. I did my interventional cardiology training, did structural coronary work, and really came to the realization that as much as I love doing that, we were missing a huge opportunity to really treat the underlying issues of what were going on, what was causing the cardiovascular concerns and diseases in the first place. And I kind of backed into functional medicine. You know, I went in kicking and screaming, and now I can never get out. It's just my home.
So Dr. Sanjay, today we are going to talk a little bit about cardiovascular health and longevity.
Sure.
Why is it important? Why are the two connected?
Well, I like to take some credit here and say that cardiology is really the OG of longevity medicine, right? When you look at every clinical trial done about coronary balloon angioplasty or stenting or statins or aspirin, we're always looking at major adverse coronary events as an outcome. So death, repeat hospitalization, repeat stroke, repeat. So we're looking at the things that keep you alive, right? And for years, for decades in the conventional cardiovascular universe, we're looking at what medications we can put people on to optimize their health. And I think, and that worked great, right? As an interventional cardiologist, putting stents in people, making them live better, because it's not just about mortality events, it's about morbidity, right? If I keep you alive, but you can't get out of your chair to walk to the bathroom because you have crushing chest pain, that's a significant issue as well. So we were really doing a lot to improve quality of life, adding life to years, adding years to life. But I think the next iteration of what cardiology really needs to evolve with tracks the longevity medicine movement, because now what we're trying to do is prevent cardiovascular disease, right? And I say the best way to manage coronary disease is to never get it in the first place. So I think the two are intrinsically related. It's like peanut butter and jelly. Individually, they're great. You put them together, it's even better.
So yeah, but organic peanut butter and
organic
jelly,
peanut
and
butter,
very
conflict-free,
low sugar,
conflict-free peanuts, and no high fructose jelly. Yeah,
no,
for sure.
thank you. Yeah, this is a functional medicine
This is
show,
functional
by the
medicine.
way.
Yeah,
All right.
add some turmeric in there too.
Okay, good. No, that makes everything good. So isn't that bad for business when you make money putting stents in, and now you're gonna have less stents to put in, and
Yeah, I mean, there will always be cardiovascular disease, right? And in fact, at the former practice I was in, one of my partners had his 15 minutes of fame. He went back and CT scanned mummies, like the Incan mummies and mummies from Egypt and all these different places. They found some frozen caveman in Sweden. He CT'd that guy, or that human, I guess. I don't know if it was a boy or girl. And found evidence of coronary artery calcification, of vascular calcification. So, the story of atherosclerotic disease is the story of life, right, as we know it. So I don't think that we will ever be able to truly eradicate cardiovascular diseases, but what we can do is prolong that time frame. Right?
So for those cardiologists that were just freaked out thinking, oh my God, I'm not going to have a job, they're still going to have a job.
I mean, I think as long as the majority of Americans are still eating the standard American diet, as long as there's stress, environmental toxins, these are things that are always going to be around. I think it's somewhat short-sighted and probably kind of a weird incentive to look at the monetary amount that you're making by putting a stent in, but rather the outcome I measure in is how many lives do I save, right? And part of the great thing about what I do now with my online programs is now I've been able to increase that scale. So even though fewer people will be having heart attacks, I kind of think of it as, well, how many more Christmases am I going to be able to have with grandma or grandpa, right? So when you measure that human toll in a very different currency, I think it just makes a lot more sense.
Yeah, and if you're saying that mummies had atherosclerosis or clogging of the blood vessels, I mean, I'm sure they didn't have fast food back then. So,
This was, yeah.
Yeah. So do you think it's safe to say that cardiovascular disease that we're seeing now that's causing strokes and heart attacks there's a slower process that's part of the aging process, but because of our lifestyle, it's being accelerated.
I think, yeah, I mean, if you think about it before, most people in caveman times did not die of cardiovascular disease, right? What happened? You got eaten by a tiger,
Yeah.
or you got hit in the head with a rock, or you had some infection and you died, right? Humans were not meant to live as long as we are. And it was really with the advent of civilization, of domesticating plants and raising cattle, that we didn't have to search for our food sources, that civilization started, and we started to see kind of diseases of society, right? So even though cardiovascular diseases have been around for a while, I don't really think they were super relevant, probably until the last 200, 250 years. But the cool thing is that during that time, science, right, particularly biological sciences, have come into view, and we've learned so much about the mechanism of these vascular diseases, of cardiac diseases, really of any metabolic condition in general, that we're able to now take this problem that probably 200 years ago we didn't know existed, and not even 200 years ago, but now we can mechanistically look at things like nitric oxide, like inflammation, and see, what are the things that we can do. It wasn't that long ago that after a heart attack, the prescription was 6 weeks in a dark room without any stimulation, right? Like you just sat there and chilled out for 6 weeks because we didn't know. I mean, it was like 1980, the IBIS-2 trial that came out, controversial at the time, where we decided that aspirin was actually of benefit in myocardial infarction. I mean, I was alive during that time, right? So this isn't like something that happened in ancient times. And I think if you look at the medical knowledge and the molecular biology and the biochemistry of everything, we're able to control this so much better. And I think that's where the break of conventional medicine and, if you want to call it integrative or functional or longevity, kind of comes into play, is that world outside of conventional medicine is now leveraging the biochemistry of humans to really reach better outcomes, right, above and beyond pharmacologic therapy, while like medications. And look, as a conventional cardiologist, I've probably given out millions of prescriptions of blood pressure pills, but I can't tell you that I ever cured anyone of blood pressure, right? Because we're treating the symptom, not the root cause. And that's what I think the calling is for me, at least in functional medicine, is being able to address the root causes through diet, through lifestyle, through all these things to really heal, because that's when humans thrive.
What do you look at? And we don't really have time today to go deep into the details of each part of it. We've already talked about advanced lipids and
Sure.
the regular cholesterol panel. There's way more to it. And for those of you that have not watched it, check out that phenomenal, mind-blowing episode where I interviewed Dr. Sanjay for the first time. But so lipids are important. What else is important? What else do you look at now as a more longevity functional medicine cardiologist? Well, so lipids are important. What else?
Well, I mean, I first think we need to look at diet and lifestyle, right?
Okay.
So we're here at the A4M conference, Longevity Fest, and there's a lot of discussion about this genetic clock or that glycan thing or proteomics and secretome, whatever it may be. But the underlying intervention for a lot of these things is, eat the right food, sleep appropriately, have connection with your community, have faith, these very kind of low-tech solutions to very high-tech problems, right? And I feel like, what my experience has been is if you can address those low-tech, quote-unquote, issues, that actually addresses about 80% of the concerns, right? So it's like the 80-20 Pareto principle. The 20% of interventions you take deal with 80% of the complications. And then you connect these higher order therapies, right? I think that in the conventional universe, we're so quick to have that pill for every ill mentality. Oh, your mood is low. Here's a pill to raise it. Your blood pressure is high. Here's a pill to lower it, right? But we really have to address kind of the underlying issues. And a lot of times that is not a supplement. That is not a medication. That is, what are the foods that you're eating? What are the stresses you're under? What are the emotional traumas you've experienced and haven't dealt with, right? And I can tell you how many lectures I had on that in conventional medical school.
How many?
0.
Okay.
Right? Because that's too touchy-feely, cardiologists in particular. I don't want to be touchy-feely with patients. I want to get them in, get them out, get a stent in, and call it a day. Yeah. But I think, the most important interventions that you can have as a physician with a patient are the human interactions that you have with them, right? Is be a human first. Like a lot of times people would tell me, Dr. Sanjay, you're the only doctor I feel like I can talk to. And I took that as a great win, because before I was a doctor, I was a person, right? And I think, and we all have to kind of realize that before we are in a healing relationship with a patient, you have to be in a human relationship with the patient. And I think that strengthens that healing bond, and it actually makes people more receptive to the interventions, be they diet, be they lifestyle, be they pharmacologic or, procedural that you may need to take.
So I'd like to get to maybe your key lifestyle factors to look at. But before that, let's back up a little bit to now you as a physician, as a longevity functional medicine physician, what are you looking at in order to assess their heart, their health, their cardiovascular health? So you're looking at either advanced lipids. We already talked before about we're looking at inflammation. What else? The blood pressure? What do you say?
I mean, I think, certainly lab testing is very important, right? I say you can't hack what you can't track, right? So you need to know what to do.
Okay.
I think, really understanding the functional capacity of patients and their functional goals becomes really important before you've come up with a plan.
How do you do
right?
that?
And you just talk to them. What are your expectations of life? What are you not able to do that you want to do?
Okay.
From a lab standpoint, I think there are some really interesting things coming out, like GAL3, galectin-3 is super interesting for brain health, for cardiovascular health. In the universe of cardiovascular testing, I think we're finally now, with the imaging and AI tools available, able to get the answers that we've needed for so long in the form of CT angiograms that can quantify plaque. And I mean, that in and of itself is probably an hour or two long of a podcast that we can do later. But, but there's not, as with anything, right? There's not one particular go-to set of tests that I go to for a patient, because really what we're needing to do is personalize our approach to people, right? Yeah, there's some standards. I think you need to know what their glucose dynamics are. I love the idea of CGMs, and I'm glad that that technology is finally getting out there, because I think...
What's a CGM?
Continuous glucose monitor. I think we think of cardiovascular medicine a lot of times, but we need to kind of shift our focus to cardiometabolic, because now what we're seeing, I think that's different than before, is that we're understanding that the vascular consequences of abnormal glucose dynamics, right? And I can tell you that from experience in the cath lab over the last 15 or 20 years, is 15 or 20 years ago when the incidence of diabetes wasn't that big, but we had a lot of smokers, right? I trained in the Midwest. We had a lot of people who smoked. We would see discrete lesions, like little, 2.5 diameter by like 15 millimeter lesions I could put one stent in and fix. I think the most recent study from Utah, 92% of Americans have poor cardiometabolic health, which sounds scary, but for the cardiologist, it's even worse, because now when we look at cardiovascular disease, we're not seeing these discrete lesions where it's just like one spot, but rather we're seeing diffuse lesions. So if you've ever looked at a pipe, like a corroded pipe, right? Like you see that crusty layer of like minerals and stuff through the pipe. We're seeing that everywhere. So when you talk about heart bypass surgery, what people don't realize is you need to be able to plug into a healthy, go around the blockage and plug into a healthy section of vessel. But now with the rise of metabolic disease and insulin resistance and diabetes, there's less and less healthy spots to poke back into. There are, the number of times in my career, 15 years ago, that I used a 23 millimeter stent, I could probably count on one hand. Now, 23 millimeters is a great day. So we measure the length of lesions, and normally, you'll have like maybe 80 millimeters of any particular blood vessel. So you're talking about now having to stent 25 to 30% of an entire blood vessel. And by the way, anytime you introduce a foreign material into the body is going to react, right? So now you're altering the local biology of that vessel by fixing it. But what we really need to do is, I say the best intervention for coronary disease would be a time machine, because we need to go back in time, right, and fix the metabolic derangements. And, there's a proverb. And whenever you don't know where a proverb comes from, you always say a African proverb, right? But one of the things that I hear is, on a sunny day, the best time to, on a sunny day when you're looking for shade, right, and you can't find it, the best time to have planted a tree was 20 years ago. The second best time is today, right? So when it comes to vascular disease, it's never too late. Like in my metabolic optimization program, I'll have 80-year-old patients that are still deriving a lot of benefit, because when you optimize your cardiometabolic health, you just feel better. Your brain is firing on all cylinders. Things just seem to make more sense.
Let's go back to CGMs.
Yeah.
You'll have a patient put on that continuous glucose monitor, and they're becoming more available and more affordable, right?
Yeah,
Even if
absolutely.
insurance doesn't cover. And then they kind of see what their blood sugar level does when based on the food they're eating and their lifestyle. So
Or their
that's
exercise,
profound.
yeah.
What about, do you ever do continuous blood pressure monitoring? Because blood pressure is important.
Blood pressure is important. I think, blood pressure is really a symptom of underlying inflammation, right? So people, a lot of people don't realize.
You said you can't, you had a fancy way of saying to track stuff. You can't.
Oh, you can't hack what you can't track.
You can't
yeah.
hack what you can't track.
Yeah, for
Okay,
sure.
Good.
So I think continuous
Is that
blood.
an African proverb?
I think I just made it up, maybe, or
Okay.
I stole it from somebody.
No,
but
it's
from a
African.
biohacker. But so with continuous blood pressure monitoring, right? It's not like continuous in the sense that you're always getting information. You're wearing a device and it checks every so often. I think there is a place for it. I think part of the problem with the conventional universe is to get that covered by insurance is oftentimes very difficult. So you'll have patients that are just checking their blood pressure on a regular basis. Nighttime, you want to see a nocturnal dip, and so that's where these blood pressure continuous devices come into play. I think it's important. I think the problem, though, is you don't want to overload people with information, right? I think that's the other side of this, particularly with CGMs. I've had patients that even with like a wearable device, like a ring base or a wristwatch based device, they're so overwhelmed with the information or the data, insights, anxiety that actually makes things worse for them, right?
Yeah.
So I think regardless if it's blood pressure, if it's glucose, heck, it can even just be a weight scale that they have at home, right? I think the important thing is kind of ushering that patient through the information that they're getting to help them understand why is this important. And, and you've had this too, where I think after the Affordable Care Act came into play and people had access to their labs on a physician portal, right? Somebody would see their labs before you would, right? And they'd call and be like, oh my God, you didn't tell me my sodium was 146, when the upper limit of normal for that lab would be 145, right? Because they have the knowledge, they just don't have the wisdom behind it, right? So I think it's important, particularly as wearables become more important, and I think particularly as AI takes a little bit more of a role, I think the HI, the human intelligence that needs to drive that becomes even more important, right? So we need to talk our patients through this.
I'll tell you from a functional medicine point of view, one of the things that I like is that our interventions don't just fix one thing.
Right.
It's not like that pill for an ill, or it's not just one mechanism. Oh, sugar's up, take this pill, and blood pressure's up, take this pill. The nice thing that I've seen is that as you can do something to help blood sugar, and then all of a sudden your blood pressure is better and they're feeling better. So real quick, we're almost out of time, but first I want to ask you, most people think about cardiovascular health as preventing a stroke and a heart attack.
Yeah.
But the reality is that cardiovascular health is much more than that. So let me ask, what immediate gain or benefit do people get from having improved cardiovascular health?
I think, in my experience, patients just say, I just feel unstuck, right? It's like just everything works better. They're going through life. Their brain is firing on all cylinders. Movement restriction becomes less. Inflammation gets better, so the back pain and all these things go away. So, like everybody's heart stops eventually, right? That's the sad reality of things. That's part of how we determine when death occurs, right? But when you're optimizing cardiovascular health, it's like one of those things that if it's working so well, you should never have to think about it, right? And I'll have patients say, wow, since you took XYZ intervention, just everything feels better. Like when I did transcatheter aortic valve, so the aortic valve is the valve that the blood gets ejected out of the heart to the body. And over time, what can happen is that valve narrows significantly such that the opening that should be the aperture of a quarter gets down to about the size of a drinking straw. And we call that aortic stenosis. That's where all the blood is getting to, like leaving the heart, going to the body. And, the engineering has been great, and I'm able to go in through the groin and put in a new valve, deploy a new valve. So there's probably no faster situation where you see a significant change in cardiohemodynamics than putting in a transcatheter valve. So I would see patients a week later, within a week, and they would tell me, my goodness, I didn't realize how bad I was feeling until I felt this good, right? So when you take these interventions, the diet, the lifestyle interventions, and these fogs get lifted, the clouds go away, people are just functioning better, they realize, wow, this is how life is supposed to be, right? I got so accustomed to my limitations that I didn't realize that they were limitations. I thought that was normal, right? So I think that's been one of the most rewarding things becoming now a functional cardiologist is,
Right.
it was great to put balloons and stents in people, but really seeing all these other aspects of life. And as you know, in the functional universe, the knee bone connected to the thigh bone, right? So when transport is working better, like hormone works better, hair grows back more, sleep is better, cognition improves, and it's just kind of like, you pull one pin and everything works better, right? So I think that in terms of the kind of holistic totality of patient care, right, this functional approach really does get people unstuck on so many different dimensions, as opposed to this is your one pill for this one disease. This is the one intervention for this one condition. We really are looking at the human as a human, not just as a collection of single-use organisms or single-use organs.
Before I did functional medicine, one of the things that really bothered me was that we would give them medication because of their blood work and they feel worse.
Yeah.
And where with functional medicine, they're feeling better. And I think bottom line, to summarize what you just said, was that you will feel better if you work on cardiovascular health. All right, so we're almost out of time. We got not 30 seconds, we have 45 seconds to tell us your favorite 2 supplements and why.
Yeah. So I'm really excited about nitric oxide right now. I think
Okay.
that, most of us just think of it as a vasodilator, but it's a hormone. It's part of the endocrine system. It affects platelets. I think when you look at glycocalyx health, right, which is something that we're newly describing, it kind of helps on all aspects. So I think that's really cool.
So a supplement that helps the body make nitric oxide.
Yeah, actually
Okay.
gives you kind of a boost in your nitric oxide. I think that line is great. And
Okay.
I've just been a huge fan of berberine for forever, right? I think if there's any one supplement that people ask me from a cardiometabolic standpoint, what do I need to be on? I always point them to berberine. And there are now new formulations that I think make up for the old ones that had more GI intolerance and all sorts of issues. And the delivery systems have gotten better. So those are kind of probably my big 2. I'll throw omega acids in there. I think that the conventional literature is asking the wrong questions of omega acids. We're putting people on fish oils, but not stratifying which fish oil, or for that matter, not doing an assessment like an omega check or a quant or something to see, am I giving enough, right? So in the conventional universe, I've got all my colleagues telling me, oh, fish oils are useless. And I just tell them, no, actually your knowledge is useless, right?
Yeah.
Like you need to think of this a little bit differently, and you have to think of it in terms of functional, chemistry.
Does it ever turn into a fight?
Pardon?
When you say things like that?
A
Does it
little
ever
bit,
get-
yeah. It
cardiologists,
gets pretty
can they
messy.
fight?
Yeah, pardon?
Okay. But
No,
you're
we mostly like
hold
hand
on.
slap. We mostly like hand slap, and it's not really.
Did
like,
we mention in the lab, you're a power lifter, right?
I am a power lifter. This is true.
They're not going to expect what they get out of you.
Well,
Like
good things come in small packages, right? You always want to be a surprise.
Yeah. So, Dr. Sanjay, I know you have a program that you're excited about to really work on longevity and reversing. Tell us about that program.
Yeah, so I created what's called the Well 12 program, and what it is, it's a 10-week program that really focuses on the 12 dimensions of wellness, one of which is health. But we deal a lot with things when we boil it down to 4 simple things: optimizing stress, optimizing sleep, optimizing diet, optimizing movement, right? You take care of those 4 things, so many things melt away. So it's been really remarkable to see the transformations. We talked about the blood pressure medications, how many millions that I've given out. But, in the program, by teaching people to eat anti-inflammatory foods, by healing the gut, I've got people coming off of blood pressure medicines
Amazing.
within like 2 weeks, right? I've had a patient who'd been on insulin for 25 years off of insulin. And so, the body wants to work correctly. We just have to give it the information and the nutrition that it needs to optimize. And so it's been, I think, the most powerful interventions I've done in my life have really been through diet and lifestyle change, not stents and balloons.
Dr. Sanjay, how do people stay in contact or keep in contact with you?
So on socials, every social, I'm under Dr. Sanjay MD, so DoctorSanjay MD. And if you're interested in learning more about the metabolic program, Well 12, you can go to www.well12.health.
And we're here at the Longevity Fest.
Yeah.
And the thing is, you walk out there with this group, this surrounding posse of your fans. And I'm really happy. I need to go thank your fans for allowing you to kind of take this time. So thank you for coming and spending time with us and sharing this information. Now your posse, your fans can have more of you. They're right out that door. We should probably make some videos of it. Sincerely, thank you so much for coming on, and I can't wait till we do this again.
Brother, it is always a pleasure to meet with you. Thank you so much.
Take care.